What is ovarian cancer?
All right, Matt. So ovarian cancer is a cancer that begins in the ovaries.
What I know that you're keeping it simple, but you're going to expand on that a little bit. I think I'm also wondering, are there any, when we talk about skin, you mentioned that skin includes other parts of the body that people sometimes don't think of as skin, like maybe the inside of the mouth or the lips or whatever. Is this just like the ovaries and there's nothing more, or is it parts of the reproductive system that some women don't know that is kind of technically part of the ovaries?
No, just be the ovaries. But I mean, the thing about cancer is that it spreads, right? So in terms of the diagnosis, usually a biopsy is collected, goes to a pathology lab, and a pathologist says, the origin, of the tumor or the cancer. They're looking at the cell line, and from that cell line, they have some, genomic data, basically genetic type tests that'll say, okay, this cancer is an ovarian cancer, and so it may spread throughout the woman's reproductive tract or to other parts of her body. But the source, if you will, would have been ovarian cells.
And so where does ovarian cancer grow?
So it starts with the ovaries, but then it spreads throughout the pelvis and the belly, and it can spread all over the body. And one of the things about this particular type of cancer is that this was the second cancer that I could ever recall hearing about in my life, meaning when I was very young, I had a babysitter who I thought, most beautiful woman in the world. I was, I don't know how old I was, but, between 5 and 9, let's say.
Mm-hmm.
And she was babysitting, and then one day she didn't come back, and find out she literally was, let's say, there on a Tuesday, and on a Wednesday she passed away from a brain tumor.
Oh, my gosh.
And I never really knew, I was too young to know anything about that kind of stuff. And then as years went on, I think I want to say, I don't remember hearing too much about anyone having cancer, at least nothing that stood out, in my memory. And then when I was in around 6th grade, there's this one of the girls in my class, one day was crying, said, hey, what's going on? And she was, said, I was just diagnosed with ovarian cancer. And of course, at that point, I think I was just learning where the ovaries are, so it was something like, I don't even know what that means, And then at some point later, she withdrew from school, and I never saw her again. And so, early on in my life, my experience with cancer was that everyone that I had found out that had cancer had died. So, as a young child growing up, it kind of gives you this sort of bias that cancer kills everyone, even though that wasn't necessarily true. I mean, it's kind of true, but just the experience with 2 people, that's what I had. So I always stood out in my mind that, at least cancers of the brain and the ovaries, someday I'd want to be able to do something about it. Not that I knew what I was going to do at that age, but just stood out in my head for some reason.
So we're talking with Dr. Tom. Again, my brain is jumping ahead to other questions that I don't even, and I haven't even asked the next question, but we're talking with Dr. Tom, and Dr. Thomas Incledon is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. Today's topic is ovarian cancer. I'm wondering, what are the symptoms of ovarian cancer? Obviously, I don't have ovaries. I don't even know what it feels like to have an ovary. I can't imagine that you can feel what it might feel like to have ovarian cancer. Do people feel it? How does it work?
Well, at the very early stage, when it's like a tiny nodule, let's say, or something that's growing on ovary, you're not going to feel anything. It's kind of comes back to the reason of having checkups and stuff with, in this case, probably OBGYN, obstetrician, gynecologist type of doctor. It's dedicated to like women's health issues, and they'll uncover something over time and so forth. But in terms of prior to you seeing a doctor, how do you know, hey, I might have, if you're a woman, how would you know if I have something going on? Things like, I guess the first point is there's minimal symptoms, maybe none at the early stages. Later stages are associated with more non-specific symptoms like fatigue, an upset stomach, back pain, pain during sex, constipation, maybe changes in the menstrual cycle. So like you may have heavier blood flow at one point and then lighter blood flow at another point of the menstrual phase, or even between from one menstrual cycle to another, you may have more blood loss one time and less blood loss the next cycle. Then bloating or abdominal or belly swelling with weight loss, pelvic or abdominal pain, trouble eating or you feel full quickly, and then urinary symptoms such as, an urgency, like you always have to urinate even though maybe you just went type of thing, or maybe going more frequently than you used to. So a lot of those symptoms, it could be for other reasons. It doesn't have to be due to ovarian cancer, but gets back to sort of a common theme of our podcast is, if something's up, just go get it checked out, right? Because it's better to find out it's nothing or it's no big deal than to wait and find out it was something more serious later on.
We're talking with Dr. Tom. It's the Ask Dr. Tom show. This episode is focused on ovarian cancer. And what are the treatment options? I would imagine it's treatable, but what are the treatment options, if any, for ovarian cancer?
Well, so let's take a quick peek here. As far as the treatment options, one, there's the standard stuff like chemotherapy, radiation, surgery. Depending upon, the diagnostic tests and some of the other things, and we may want to, go over some of that, as well, is just to get an idea of how much cancer is in the body and where is the cancer located. And then that would then say, okay, like a competent oncologist would say, all right, here's what we recommend to do. And then outside of, let's say, those recommendations, if someone were to come to us, we would say, all right, here's other stuff to consider as well.
My screen, my screen froze up.
Of course. How about this? Let me use this time then while your screen's unfreezing. Let me kind of go over how should it look like if someone thinks they have ovarian cancer. So a woman says, hey, I think I might have it. What tests or what should happen to kind of get to the bottom of this so you could solve the problem once and for all? And so the way it should kind of go is you're going to have a physician consult, whether it's an OBGYN or a different type of doc initially. Usually the first time, the first doc you see is you're just going in because you have, let's say, back pain. You're not thinking cancer at that point, or maybe you have abdominal bloating. The doctor's going to run some tests and, do a physical exam and say, hey, there's swelling where there shouldn't be swelling, right? Fluid in some tissue or something. And then based on what, they see with a physical exam, they may recommend things like imaging tests. An imaging test could be anything like an ultrasound. An ultrasound is usually done because it's pretty quick, pretty inexpensive. Most insurance carriers cover it. They just say, hey, there's a growth. There's something there that we don't normally expect to see. And then based on what that particular ultrasound shows, they may order a follow-up test. Follow-up test may be anything like a PET scan or a CT scan, but basically gives you better details of the structure and also where the cancer is spread throughout the body. And then there may be some other types of tests that are done for this type of cancer. It's a little bit different than you might normally see. Things like what they call a barium enema X-ray, where they basically put like a contrast solution in you. So when you do an X-ray, they could see details of the anatomy a little bit better. There may be an MRI. If the doc thinks like, hey, the cancer may have spread, let's say if you're coughing or you sound like there's fluid in your lungs, they may do a chest X-ray just to see if something's going on there. Outside of those sort of imaging tests, then you got other things like the docs can send a tube into the tissue, either in the ovaries or around the other tissues in the area, just to see what's going on in there. And they could use like a video camera to actually look around and see if there's any changes, that are unusual. They can also do a colonoscopy. And, a lot of times people would say, well, this problem's in a different part of my anatomy. Why are you doing a colonoscopy? Because you got to remember, the doctors are thinking as a cancer spread. And the thing about the what they call the abdominal pelvic cavity. So basically like your belly and the surrounding area, a little bit below it, is it's so dense with organs and there's so much blood flow and circulation and fluid in there naturally. When there's cancer there, it could quickly spread to other organs very rapidly. And so you want some different procedures done just to get a better sense of where is it going? Is there like a tumor now growing in the colon, for example, things like that. And the reason is independent of the threat of the cancer to someone's health, you have other like mechanical problems. And those mechanical problems would be things like just the mass of the tumor could impact urine flow, or could impact when you go to the bathroom, have a bowel movement. Imagine if your colon has got blockage, it's going to be much harder to have a bowel movement. And these are things that a lot of times people don't think about, until it happens. You're like, how did I get in this situation, And then, of course, in terms of like from the pathology perspective, like a surgical pathologist or some other doc may do a biopsy. Then they send it out to a lab, and the lab's going to do, the genetic stuff that they do just to identify, like, hey, it's ovarian cancer and what mutations are in these cancer cell lines. And then on the blood side, there's blood tests that could be done. Common ones would be a CBC or complete blood count, a CMP or comprehensive metabolic panel, a cancer antigen called CA125, a hormone called HCG or human chorionic gonadotropin, and then two other markers. One is called AFP or alpha fetoprotein, and the other one is an enzyme called lactate dehydrogenase. And then depending on, what some other workup shows, there may be things like a marker called inhibin and some hormones like estrogen and testosterone. Because let's just say if it turns out that this is a type of ovarian cancer that's driven by hormones, then you want to make sure your hormones aren't high, right? Because then if they're high, they could be driving the production of these cancer cells. And there's also now things like genetic counseling. And this might be important because it appears like sometimes like a woman may have ovarian cancer, and then her daughter has ovarian cancer, then her daughter may have ovarian cancer. And there may be, some genetic predispositions, or there may be something in environment. One of the things I see a lot is see 3 generations with the same disease. And then people say it's genetic because my grandmother and my mother had it. And then when we test them, we find out it's not genetic. No one actually had a gene for that disease, but they were living in the same environment, for everybody's life, if you will, and they're eating the same diet, if you will. So there's a lot of consistency on a lifestyle, which leads to, the outcomes that they're all experiencing. So the way to make really, really big impact to prevent this from happening in future generations of that family is to change the lifestyle, because that could be a big win right there. This does open up a side kind of tangent that there's a lot of home-based testing that's opening up right now. And it's a market that's ripe, because you could go right to your pharmacy, get a test kit, and test yourself at home. It could be a urine test, something like that, saliva test. Most of these home tests, while it's cool technology, and it's going to definitely pave the way for better insight in the future, there's a limited amount of data get collected. So like maybe out of the thousands of mutations for a different gene, they're testing for 2. So if you're negative for those 2, it gives this false sense of security, like, oh, hey, you don't have this problem. But there's like 998 other mutations that weren't tested for. And so now it's like, wait a minute, it's kind of like a password on your computer, and you think, hey, it's safe, no one can hack into it. And meanwhile, you turn on your computer, you turn on your browser, and someone came in through a back door of the browser, right? Yeah. They still got into your system, even though you had a password. So it's kind of like a false sense of security, if you will. And it's kind of like that with some of these home-based tests. They're not thorough and comprehensive enough to give people all the details they need, which gets back to why you got to see a doctor.
It's the Ask Dr. Tom show. We're talking with Dr. Thomas Incledon. He's the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making Thomas Incledon one of the most sought-after healthcare professionals of our time. we're going through these cancers one by one as we tape for the Ask Dr. Tom podcast, and today's focus is ovarian cancer. What are some of the treatment options for ovarian cancer specifically? Do they differ from other cancers?
Well, so would for treatment options for ovarian cancer, standard stuff would be like the chemotherapy to radiation surgery. Outside of that, there's a number of things that we do at Causenta that really set us apart in terms of creating like complementary tools. So let's say someone has stage 4 ovarian cancer. This cancer spread all over their body. It's going from their brain to their pelvis, maybe a little bit further down. It would be very risky for that woman to just do chemotherapy or radiation, like to do any one treatment. It's like putting all your eggs in one basket. And then with some of the therapies like chemotherapy, radiation, there's a lot of side effects associated with that. But where the tumors are, maybe there's too many of them, or where they're located in the body, surgery isn't going to help, fix everything. So they may be able to get some stuff removed. But a lot of times, if there's that much cancer, doctors don't recommend surgery because they're like, well, if we get rid of this one tumor, you still got 5 others. Like, how is that having any impact here? And so what we'll do is we'll study the biochemical pathways by which the drugs work, and then we'll create strategies that work through other pathways to actually kill the cancer cells, or at least produce a way better result. And what we've been finding is our patients don't have hair loss. They don't have any side effects generally associated with chemotherapy. So we can really, beef up standard protocols dramatically and produce much better results. And maybe, I don't know if you have this in your on your end, Matt, but one of the things maybe is, do you have the statistics and the risk factors stuff?
Yes.
Okay, cool.
Yeah, in fact, it sounds to me, even before going into this, when I looked and I go, okay, we're going to talk about ovarian cancer, that seems, not that any cancer is not serious, but I thought, ovarian cancer is going to be very hardcore and very serious, and this one's going to be very fast acting, and this is scary, scary stuff, and probably very common. But I'm looking ahead a little bit and cheating, and I'm seeing some of the statistics. It doesn't look like it's as common as I suspected. But so what are some of the key statistics according to the numbers for ovarian cancer?
Yeah, so this is based on 2019 data from the American Cancer Society in the United States. So basically about 22,530 women will receive a new diagnosis of ovarian cancer. So that's like in 2019, we have all these new cases. Then out of that 22,530, about 13,980 women will die from ovarian cancer. Well, actually, I misstated that. So you have the new cancer cases, but their stats don't say exactly how many women will have ovarian cancer in the year of 2019. But out of the women that do have ovarian cancer, 13,980 will pass away from it. Then ovarian cancer ranks 5th in cancer deaths among women, accounting for more deaths than any other cancer of the female reproductive system. So in that regard, you might say, ovarian cancer is one of the more serious cancers because of the fact that so many women die from it. A woman's risk of getting ovarian cancer during her lifetime is about 1 in 78, and her lifetime chance of dying from ovarian cancer is about 1 in 108. So the odds are 1 in 78 she gets it, and then 1 in 108 she passes away from it. This mostly occurs in older women. Half the women with ovarian cancer are 63 years of age or older. It is more common in white women than in black women. And the rate at which women are diagnosed with ovarian cancer has been slowly falling over the past 20 years. Part of that is because of better testing and screening. Women usually are more likely to go to checkups and exams, for example, than men.
Yep.
So you'd expect to see some of that as contributing to it.
Plus, they're typically going to do their annual OBGYN, and that's Boy, there probably should be something like that, even, for men, to force them to go in, because I think that's a key. Even people that don't go to the doctor that often, you can pretty much count on a woman to go at least once a year for that sort of a checkup. And guys, we could go for 10 years without checking up on anything.
Mm-hmm.
Uh,
Yeah, well, because the way most people define health is they never had to see a doctor.
Yeah. It's like a victory for guys to go like, oh yeah, I don't have to go to the doctor. I wonder that would be a great thing for some sort of a general male wellness annual, a reason besides the obvious. Because I think a lot of guys don't even think about it. Well, I'm not 45 yet, or whatever the age is that you're supposed to get the prostate exam, and then I'm not that age yet. So there's this window where they think they're footloose and fancy free, and they don't have to worry about anything. And that's probably the best time for them to kind of get into the habit and get on top of things. We're talking with Dr. Thomas Incledon. This is the Ask Dr. Tom show. If you have a question for Dr. Tom about health in general that you'd like us to address on future episodes of this podcast, this radio show, you can submit your question at askdrtom.com. Spell out the word doctor, askdrtom.com, and we'll review those for future episodes. Today's episode is about ovarian cancer. So what are the risk factors of ovarian cancer?
So with ovarian cancer, the risk factors sort of like going down a list is one is getting older. Two is being overweight or obese. And just a side note, years ago, we just used to think of, if you're getting a little fatter as you get older, it's just like, okay, it's going to be harder to move. We now know that excess body fat is linked to all kinds of diseases because the fat cells on their own produce inflammatory substances that can cause DNA damage or create a more inflammatory environment in our body. So right now, more than 1/3 of the United States is overweight or obese. And some of the data that doesn't quite fit in my mind is we're getting fatter than ever as a country. And just to make it maybe even more of a bolder statement, the entire world is getting fatter than ever. It's not just the United States. And even though we're getting fatter than ever, there's some claims that the government, different agencies put out that certain rates are going down. I don't know if that's accurate enough because the expectation is as obesity rates go up, we should see an increase in different cancers going up as well because excess body fat is strongly linked to a lot of these cancers. What I seem to hear more than ever is it seems like when I was a kid, I hardly heard of the word cancer. And then I would say when I got to my mid-30s, started hearing a little bit more. When I got to my 40s, I started hearing it. And now I hear it every day, multiple times, even in social situations where people don't know what I do for a living. Mm-hmm. So it's not like I'm hearing it because people are looking for me. I could be out, in an environment where no one knows who I am at all, and I'm hearing casual conversations or someone saying, yeah, I'm dealing with this. And so my observation has been that I think cancer rates are on the rise as a whole. And so I think a lot of that has to do with reduction in activity, alterations in the microbiome, and people getting fatter more so than ever before. So getting back to the risk factors for ovarian cancer, some of the other risk factors besides overweight, obesity, and getting older, having children later or never having a full-term pregnancy, using fertility treatment, taking hormone therapy after menopause, having a family history of ovarian, breast, or colorectal cancer, having a family cancer syndrome, meaning lots of cancers throughout the family, having breast cancer or having had breast cancer, I should say, and then smoking and alcohol use. Now, a couple of things I do want to just insert here is that the way things are generally done in medicine is they're done almost like in a transactional way. And sometimes there's a loss of awareness about the other things going around that may influence the context. So one thing would be like the statement where, having children later in life is a risk factor for ovarian cancer. Had those women had vitamin mineral testing and had their vitamin mineral levels been, addressed accordingly, and had they been introduced to maybe some healthier lifestyle options, my prediction would be you would see a dramatic reduction in the risk of ovarian cancer because a lot of the inflammatory events, a lot of the aspects of pregnancy, like the baby has priority over nutrients, over the mother, a lot of that stuff would be addressed. So it would become a problem for the mother later on in life. But if it's not addressed, then, you don't really make any impact. So an example would be when a woman is pregnant and she goes to see an OB/GYN doctor, almost all women get the same prenatal vitamin. So every woman now is exactly the same. No one's looking at, well, if we're all genetically different and we all have different microbiomes, and we have all these different lifestyles, why are we doing the same thing for everyone? And the reason is just quick. Give someone a prenatal vitamin and the next patient you could see. But for women that, are interested in having successful pregnancies, there's so many better options than that right now. So you still want to maintain a relationship with your OB/GYN doc, but then you would come to like Causenta to get much further workup of how do you have a healthy pregnancy so it doesn't have a negative consequence on your health later on. Now, in terms of there's some risk factors that are not very clear. Some are like taking androgens like testosterone, exposure to talcum powder, and then diet. Like how do those factors influence ovarian cancer risks? There's too much data that kind of goes both ways. So yes and no, and so it's difficult to draw a firm conclusion. And then another one is lower risk. So women that breastfeed and women that have been on birth control appear to, and have had pregnancies younger in life, appear to have a lower risk for ovarian cancer. So that's kind of like the summary of the different types of risks, if you will, for ovarian cancer.
It's the Ask Dr. Tom show where we talk to Dr. Thomas Incledon about health topics. We're currently going through various forms of cancer. This is the ovarian cancer episode of Ask Dr. Tom, and you can get a question in if you'd like at askdrtom.com. Please take a moment to share this on social media for people in your family. The purpose of covering this information is to make people aware of the seriousness of early detection as well as the cause not to fear getting detected early. In other words, the more you can do, the more time you have to do it, the better off you can be. And freaking out just because you hear the word cancer isn't going to necessarily help people, and especially if it keeps you from getting a early detection or a exam, etc. So Dr. Tom wants as many people to see this as possible, and that we require and we depend on you to do that, sharing this with your friends and family. So like I said, we're talking about ovarian cancer today. One of the things I hear about, you mentioned over the years hearing more and more about cancer as time has gone by. I hear more and more about ovarian cysts. Is there a relationship between ovarian cysts and cancer? Is that something that women should be concerned about?
Yes, so they should be concerned about it from the perspective that normally you shouldn't have cysts all over the ovaries. I mean, it can happen, but the way I would say is first, like, what is a cyst, right? So a cyst is usually something that's benign, and it's usually just like a fluid-filled sac. It could develop in or around the ovaries. So it's kind of like the basic definition. And then now, can those cysts on the ovaries, can they lead to cancer later on? So most of the time, they're harmless and clear up on their own. We actually had... We've treated lots of women with something called a condition called PCOS or diagnosis PCOS, which is polycystic ovarian syndrome. And typically, there's some obesity, there's all kinds of hormone dysfunction issues, and we address all those areas, and then the cysts disappear. There's also data that just eating more fruits and vegetables may reduce ovarian cysts, and there's some data that just losing weight. So, essentially what it appears is like embracing a healthier lifestyle seems to reduce cysts on the ovaries. In rare cases, though, some of those cysts can develop into ovarian cancer, and the risk of a cyst becoming cancer is higher in women, that have gone through menopause. So, like, the take-home answer would be If you're seeing an OBGYN, they should be doing something to monitor and follow up the ovarian cysts. And what you may see, like normally if they're benign, you might see them show up and they disappear. And then they come back later. So they're kind of coming and going, not at necessarily a regular interval, but it's some sort of process over time. But if you're engaging in healthier lifestyle, behaviors, choices, then you should see the cysts go away and less of them come back, or to come back less frequently.
And if you're thinking like, okay, well, how do I eat better? How do I lose weight? How do I get a better diet? There's a and you've tried and you've been unsuccessful, like many of us. There is a free guide that Dr. Tom and the team at Causenta have put together. It's the Rainbow Diet Guide. It's a free download. Anybody can grab it, and it maps out specifically, one of the things that Dr. Tom comes back to over and over again is this wide variety of colorful fruits and vegetables and foods and things. And so it's laid out very, very well for you, and it's easy. You can take it to the store. You can take it when you do your shopping, etc. You can go to causenta.com and just go to Causenta. I'm doing it right now. You go to causenta.com. And on the top, there's a menu item that says resources. You just scroll down to publications, and when you click on that, you can download the GL Rainbow Diet Guide. It's totally free, and the GL stands for glycemic load. Don't worry about those words. Just look at the diet guide and print it out and take it with you. Put it on your phone, put it on your smartphone, whatever it is, and take it with you, and it will help you tremendously. It's a free resource, and anybody can use it. If you know somebody in your family, you or anybody's been diagnosed, while you're at causenta.com, go to the main page and just fill out an application to talk to somebody on the phone about your particular situation. And the team at Causenta can talk to you about putting together a plan that's designed just for you. Anything else that you'd like to add, Dr. Tom, about this particular form of cancer, ovarian cancer, before we wrap up this episode?
It's I've seen, over the years, I've seen a lot of women pass away from this type of cancer. And what I would encourage any, person that's listening to the podcast, if you have ovarian cancer, someone has ovarian cancer, please just give us a call, because this is one of those cancers where you kind of want to use as many weapons as you can, because I've seen lots of women start something, it looked like it was working, and then later on it was worse than ever. Because you just can't, it's difficult to kill cancer with a single weapon. There's just too many possibilities that it can mutate and change. And the idea is we want to save lives, and we want to prevent people from dying from cancer in general. In this particular podcast topic, ovarian cancer, there's a lot of these women usually have kids and they're younger, and it's a pretty stressful time to think about, hey, I deal with a life and death matter. Well, I got kids I'm trying to raise and that kind of thing.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is a standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.